I'm here with Helen Moulinos, Chief Executive of Power, which is the advocacy charity. Welcome, Helen. Thanks for joining us.
Thank you for having me, Sophie.
It's great to have you here. So, you're currently at Power, but prior to that, you've had a variety of roles in the charitable sector, including Marie Curie, Age UK, the Alzheimer's Society, just to name a few. Can you tell us a bit about your personal journey? What's motivated you and driven you in your career?
Sure. So I suppose my reasons for being at Power start probably 30 years ago, where I started my volunteering career. So prior to joining the charity sector 7 years ago, I spent 20 years in the corporate sector. And the entire time I lived a little bit of a double life in that I had a corporate job, very buttoned down during the day. And then I was leaving work, and back then I was living in New York, so I was doing work in social care, particularly around HIV and AIDS, and supporting beneficiaries in those areas. After 20 years in corporate life, I started to really think about my impact, my career, and what I wanted to do. I was also grappling with my father. So my father lived with OCD and schizophrenia most of his life. And I suppose what I didn't realize is as a young teenager, as a young woman, I would have acted as an advocate to him, helping to make sure that his voice was heard, whether that was in the healthcare system, whether that was in immigration with his employer. So advocacy is something that has come naturally to me and something that's personally impacted me as well. I also live with mental health and disability. So I grew up knowing depression, understanding dyslexia. And then after 9/11, I was a 9/11 survivor. I inherited PTSD and hearing loss. So 95% of the hearing in my left ear went because of what happened that day. So professionally, I suppose, coming into the charity sector 7 years ago and working with organizations like Stonewall, Marie Curie, Age UK, Alzheimer's Children's Society, really the importance for me professionally to address inequality in society and help socially excluded people is one that comes very naturally to me.
Thank you, Helen. That's incredible to hear about your experiences, especially, being part of 9/11. That must have really affected you, and it's incredible to hear about how that's motivated you to go on to do things to help other people.
Yes, yes. No, it was definitely an interesting time and a very traumatic time. So I suppose if I can join an organization like Power and help others to get support that they need, to have their voices heard and have their rights upheld, then that's especially important to me.
Absolutely. So you're currently Chief Executive of Power. Can you tell us a bit more about Power and the mission that you have?
Of course. Power was established in 1996 by a group of six founders who founded the charity around a table at Harpenden Town Hall in Hertfordshire. Power stands for People of Hertfordshire Want Equal Rights, although today we are a national advocacy charity. So all of our founders at that time had disabilities and were fighting social injustice and challenges in their lives. Today, Power supports marginalized, vulnerable, and socially excluded people through its charitable work. This past year, we would have supported 55,000 people through one-to-one advocacy services, and around 253,000 through our community health hubs, which provide information and support, and over 400,000 people through digital self-advocacy information resources that people can download to help themselves. We specialize in mental health, impairment, and disability, but we don't exclusively work in those areas. So really anyone who is in need of advocacy in their lives could work with Power. So to give you an idea, Sophie, 38% had a mental health condition, 24% were over 75, 10% had dementia, 3% had autism, just to give you a few statistics.
It's an absolutely incredible organisation, and I'm interested in what you say about 24% of the people you support are in the over 75 age group. Perhaps you could tell us a bit more about what you see as the particular needs of that group when it comes to advocacy and advice.
Sure. If I think about our beneficiaries in the over 75 age group, they present with particular needs, typically in relation to a lack of, let's say, issue-specific mental capacity, So sometimes there's an overriding need to protect their fundamental human rights. So we all know loved ones, for example, who might be living with dementia. This is often when decisions are being made by health or social care professionals on how or where they should live their life or what treatment they should receive. We advocates, we also support people over 75 to live their lives free from harm or abuse. We support them to speak up or speak for them to raise any safeguarding concerns that might be happening in a care situation, to ensure their voice is heard when decisions are being made by someone else or put in place without their wishes being known, to also protect them from abuse. Advocacy really is about supporting access to to appropriate healthcare services and social care information. And it's really all about maintaining independence and choice. So that is a high priority for our beneficiaries and service users over 75.
Okay, and could you give perhaps some examples of the type of support that the over 75 groups might be trying to access that you could help with?
Sure. You may know this, and this is sort of written into sort of statutory requirements with local authorities. So we work with 83 local authorities around the country. But the principles of really advocacy is that organizations must involve people in decisions made about them, their care, their support. It doesn't really matter how complex those needs are or what environment they happen. They have to weigh up their feelings and wishes. So the things that an advocate can help with to ensure voices are heard, things like care needs analysis, an assessment of a carer or carer's environment, advanced care plans, including things like do not resuscitate orders, and also safeguarding. So something I would really encourage your readers to consider, and insist that they have access to relevant information, have their questions adequately answered and heard, and make their views known about decisions around their care.
And you also mentioned within their dementia, supporting those with dementia. Now, it's something that a lot of our readers will have personal experience with, supporting someone with dementia or trying to get them access to the right support and information that they need. I know that you support those people through Power, but also I see that you've worked for the Alzheimer's Society in the past as well, which is closely related. Do you have any advice for people who are trying to get access or social care support for those particular conditions?
Many of your readers will know about the CARE Act of 2014, but for those who don't, what this says is that local authorities have to carry out an assessment of anyone who appears to require care and support, regardless of their eligibility for state-funded care or not. So I think the key to understanding this is they have to focus an assessment on the person's needs and how they impact their well-being, and the outcomes that they want to achieve through their care. It can get sometimes confusing, and it can be a fragmented process to get the right support. So if your relatives are needing a mixture of health and social care, it's not always carried out as an integrated needs assessment. So that's sort of one advice we would give, is really that it should be carried out as an integrated needs. And the idea here is it's very much about person-centered care, not sort of fragmenting that. So I suppose an advocate can help to make this process less confusing, less complicated, and also help either families or people living with dementia to navigate through. I know it can be really hard to know where to turn if life is getting difficult to cope with, but hopefully an advocate is a really good place to start. GP practices also have link worker schemes, which you may have heard of social prescribing. We work hand in hand with social prescribers and community navigators as well. So that's another sort of piece of advice.
Okay, brilliant. I think it echoes what we've heard from some of our readers in terms of what you say about the CARE Act and the assessments. Many people that we've spoken to feel like they don't have much choice and control when it comes to having a say in the social care that they receive, especially when that is elderly care. So we've heard people say things like, I guess the council will decide what type of care I can have, or I'll get what I'm given almost. And what would you say to people who feel like that? And what advice would you have for them?
Well, I'll talk about sort of the rights that they have. So local authorities must involve people in the decisions that are made about them, their care, their support, and their referral pathways. It doesn't really matter who they are, but they have to weigh up their feelings and wishes. So this could be, again, in care needs analysis, assessment of care or carers, or medical or healthcare access, advanced care plans, safeguarding. So I would really encourage your readers to insist that they have access up to the relevant information, have their questions answered, and make their views known.
Brilliant, thank you. It's hard to talk about all of this without thinking about the current context of COVID-19. Obviously, when we're talking about vulnerable, marginalised people who may not have access to the support that they need, COVID-19 is going to have had an impact on that. In June, Power released a report which outlined that vulnerable people are falling through the cracks in the system and advising for more people or patient-centred guidance. I wondered if you could tell us a bit more about what was meant by that and the impact you've seen so far of COVID-19 on the kind of people that you support.
Sure. I think one of the things we observed before COVID-19 came across and before the lockdown is there were a number of people in society who were vulnerable, marginalized, and socially excluded. If you think about each of us as human beings, we have a number of lived experiences and characteristics. So I think COVID-19 probably exacerbated some of the isolation that those socially excluded and vulnerable people had, some of the circumstances that placed them at different risk factors or harm. But also, if you think about where the focus was by the UK government these last few months, it was on preventing transmission of the virus, but not necessarily taking into consideration that by pulling resources over to dealing with the virus and prevention of virus transmission, a lot of people did not have the care that they needed, access that they needed, information that they needed, or could have been exposed to situations like in care homes where there weren't the right provisions made. So I guess the issue has been, again, the protection of vulnerable communities. I think it wasn't clear who to go for what. I think people were possibly treated as labels, not human beings, and really considered. But also, there were a number of easements that were created through emergency acts like the coronavirus bill, which really created a really impossible situation for human rights and social care and healthcare. Mental Capacity Act, for example, was also not written for COVID-19. So what do you do when COVID presents you with these situations in terms of access, inclusion, marginalization, but also scenarios that were never planned for before, such as, let's say, COVID tests or COVID testing in mental health wards or care homes? A COVID test is an invasive procedure. So how does one interpret an individual's wishes and feelings when mental capacity is not there to perform a COVID test, for example, or to assess health? So, yeah, it's been a very interesting situation, not entirely joined up, and really problematic for people with mental health and disability.
And have you seen that come through in the people that you support? Have you heard any instances where people struggling to get that support, or any kind of stories that you're willing to share around that?
Yeah, so what's been really interesting is we have seen a sharp increase in demand and volume, not just to our helplines, but also to our one-to-one advocacy. So over the last 2 months, we were seeing nearly 7,000 people a month, so in April and May, which is significantly higher than what we saw in previous years. I mean, the situations that are presenting themselves are not just around health and social care. Because of the state of local government services and NHS services, people are having issues with basic needs like food parcels. A lot of people have been furloughed or lost their jobs. So there are some basic needs situations going on: housing, again, food parcels, access to health or care. also things like digital exclusion sort of come into this. So in a world which is mostly virtual, how does someone who's not computer literate actually get their information? But lastly, I think the kinds of things we're seeing is not really an appropriate thought or provision for people with mental health and disability. And this could also include access to information, and this could also include safeguarding as well.
Okay. And you mentioned particularly in the digital exclusion, which I'm quite interested in. Do you see that coming out more for the over 75 group that you support?
Well, if you think about digital exclusion, it's not just over 75. So, for example, if I am dyslexic or perhaps I have lost my sight and I am reliant on a software reader, if information is being put out, let's say, through the door, so I know my local council would have dropped pamphlets through the door. Again, if I was visually impaired, I wouldn't have received any of that information. But also, if, let's say, you're living with a learning disability or autism, a lot of that information was not made available in an easy-read format. So I would actually argue that a lot of the information during the lockdown hasn't actually reached people. And when we talk about, how big is this problem? There are 13.9 million people in this country living with mental health and disability. So that's about 22% of the population, a proportion of which will be digitally excluded by sort of the way that information is put out onto the internet. So I would sort of question really how much of that has reached the most vulnerable people or socially excluded people. And I think it's not a problem that's specifically for the over 75. I think it's a problem that really cuts across society.
Absolutely, that makes complete sense. Power supports, like you've mentioned, hundreds of thousands of people a year with your services. I wondered if you had any individual stories from the people that you've helped, personal stories that you'd like to tell us about or share with us.
One story that comes to mind is Yusuf's story. So Yusuf was a client of ours. He emailed Heart's Help, which is one of our health hugs, to ask for help. And an advisor, Michelle, called him back to discuss his issues. Now, he had tested positive for COVID-19 3 days ago and had been advised to isolate for 7 days initially. Yusuf said he had bipolar disorder. He also disclosed that he had a manic episode recently. Our advocate, Michelle, determined from the discussion that the police had visited Yusuf, but that he had not been arrested. So there were a number of circumstances going on. Yusuf's first language was Arabic, so Michelle spoke very clearly and slowly to help Yusuf to understand the support which was available to him. Yusuf had some, command of English. She also checked his understanding at various points. Now, our advocate identified that Yusuf had also money worries. He was building up debts. So she was able to make a referral to CAB for budgeting and financial advice, helped him, with his landlord, but also helped him to access a mental health worker to support him. And through that referral to mental health intervention support, an advisor agreed to sort of speak to Yusuf the next day. She also provided him with a number of information assets through Heart's Help. Now, I'm using Yusuf as an example because I think it's a really good illustration of how power works, again, in this person-centered way. Yusuf had a number of things going on, and our advocate was sort of resourceful enough to look after as many things as possible and connect Yusuf with resources that could actually help him to sort of navigate through his issues. I think one of the really special things about advocates and one of the special things about the people who work at Power is, if you think about it, they push on closed doors for a living. They clear paths, and they're really there to sort of empower people to make choices that better their lives. So yes, I'm really, really proud to be part of this organization.
My final question is a more hopeful note for the future. So if we imagine ourselves 5 years in the future, what do you hope will have changed for people who are currently vulnerable, marginalised, or struggling to get support?
Well, first of all, I'm quite ambitious, so I hope that we reach many, many more people and tackle some of the barriers that they're experiencing. So numbers. Right now, Power is the largest social care advocacy organization of its kind in this country, but we still are not reaching even enough people out of that 13.9 million I alluded to earlier. The second is I'm hoping over the next 5 years, some of the stories, our case studies, our work, some of our campaigning will help to change hearts and minds in the general public, and hopefully reduce some of the negative attitudes and stigma around mental health, impairment, and disability. So I'm hoping that we also influence sort of the public's hearts and minds for the better. I'm hoping we address more root causes of the problems. Advocacy is often there when society structures and powerful organizations fail people. So I'm hoping that rather than just cleaning up the mess sort of once it occurs, we can have a seat at the table at helping to address either the laws, the circumstances, the environments that create those problems to begin with. I'm hoping over the next 5 years we have a better understanding of some of the unmet needs that our service users have. So I think it's always a learning journey through all the cases we have. However, power has what I would call, Sophie, is a very fleeting sight of someone's life. So we're there when they're in crisis. We don't necessarily follow the whole story. So the more we can piece together about someone's unmet needs, I think the better we'll be equipped to support people. I'd like to see that society is more focused on the person, not the label. And also that advocacy hopefully is less needed because all the problems I've described are being resolved.
I'd like to pick up on a couple of points you said there. Really, really interesting stuff. You mentioned about the changing mindsets and changing feelings. What kind of work are you doing with power, or are you hoping to see more widely that would help that matter?
Sure. So right now, I think although power works with a number of different areas, so not just social care and healthcare, we also may work with housing, we also may work with immigration and other agencies. I think we'd like to start sort of moving into other areas. So if you think about each of our unique lives, we can be parents, we could be carers, we could be children, we could be employees at any given stage of our life. So I think we're looking to create advocacy opportunities in a lot of those life pathways. So that's sort of the plan for the future.
And you also spoke about the systemic and structural changes, and advocacy being almost a route when the system has failed in some way. Do you see hopeful green shoots in that area? Do you see things changing for the better, or do you see things changing for the worse, or somewhere between?
I see a recognition by government in the last sort of few months and weeks, particularly around COVID. So, for example, some of the parliamentary consultations that are out there and some of the studies and inquiries that government has commissioned really relate to people's experiences under COVID-19 to help to broaden understanding about what's happened. I think a lot of the conversations are now looking at rights and how did different laws, procedures, safeguards either protect or not protect people. So I think the fact that the right questions are being asked, I know the Office of National Statistics has been tracking, for example, COVID-related deaths and how those impact, let's say, BAME communities or people with learning disabilities. So I think we're really in the analysis phase right now. I'd like to think that this focus on COVID-19 post-lockdown and post-pandemic will continue, and this focus on vulnerable and marginalized people again will continue, not just under the banner of COVID, but how we can sort of better society and again remove barriers. So I think part of it is about hearts and mind. I think there's a big responsibility on us and also the general public to be writing to MPs, to be writing to ministers and saying, well, this is really important. And if we want to address inequality in society, whether that's inequality in services or the laws that are put out, it's really up to people to go out there and demand better circumstances for people with mental health and disability.
I think that's a great note to end on, how people can actually help the cause themselves. And in the notes to this interview, we will also post a link where people can support Power if they so wish, by clicking on and donating or supporting in some way. Thank you so much, Helen, for joining us. It's been an incredible interview, and hearing about the work that Power does, which is also an incredible organisation. So thank you very much.
Thank you very much, Sophie. It's been a pleasure to be here.